Good morning.
Morning.
Show of hands. Who ran the 5K this morning?
Yeah.
Anyone? Anyone? Scott, did you run it? You're in shorts over there. All right. Did you win? Did he win? Okay. Everybody want to welcome you this morning out to our hands-on demo for improving reproducibility and extremity mobilization. So first, I'll introduce myself. I have more than 10 years of radiation therapy experience. Most of it's in protons. I started in protons and went around different centers. And I like to do these bios because a lot of times it's like six degrees of Kevin Bacon. You know somebody who worked there. You know somebody who you worked with. But started out at UFPTI in Jacksonville as a radiation therapist, fresh out of school. After that, a few of us left from Jacksonville and we went to the Dallas Proton Center. So I was a lead therapist there, and we got to open that Proton Center from the ground floor. And it was a pretty good experience opening it up, making policies and procedures, that kind of stuff. I commissioned an MRI while I was there as well. Then I left there. I'm actually from Nashville, so I went back home to Nashville and became the manager and opened another Proton Center for Provision Cares in just south of Nashville in Franklin. And then I got fortunate enough to have the best job ever, and Orfit offered me a position back in 2020 during COVID. So I also got lucky that I got to leave the clinic during COVID and join Orfit's team. So really, really fortunate. The objectives today, during this session, attendees will learn how to adapt the immobilization devices across several different supports and optimize and customize patient treatment based on the unique parameters of whatever your patient's tumor, mobility concerns, and the care plan from the doctor. This workshop will also enable participants to reproduce the extremities in order to further streamline your workflows, because sometimes we know that extremities can be like a clinical setup. You put them in the backlock, you image them, you come back out, you have to rotate the leg or something. So we're trying to streamline the workflows, make it more reproducible. Participants will also gain a greater understanding about the benefits of using thermoplastics with extremities, because a lot of times when you're immobilizing extremities, you're using thermoplastics that are not necessarily designed for extremities. How many people in here have ever used like a U-frame mask to immobilize a foot or something? So kind of tough. You have a lot of space in there and it's not really shaped like the foot. So we'll show you kind of how ours can contour to the foot or whatever extremity you're trying to do a little better. So we'll teach you some things to use and make it a little more customizable. Here's the overview. We're going to be immobilizing lower and upper extremities for radiation treatment. And we know that can be challenging. So reproducibility can often be compromised as therapists are forced to wield together like an assortment of tools. You have tools that are not, like I said, not really designed for extremities. So you're kind of making this Frankenstein situation and trying to make it work in a clinical setup. So replicating a position with back bags and cushions and tape over 20 fractions is not easy to put that patient back in the same position. So trying to take the clinical setup out of the whole situation. We're going to get you up in a little bit and try it. So we're going to practice some techniques with the Orfit team here. We have some other members over here that will help you guys out in making some masks here in just a little bit. So we actually have a user though. This is Roz. I want to introduce him. He is one of our customers that uses this in his clinic quite frequently. So Roz has more than 23 years of experience in radiation therapy. He's a lead therapist at the City of Hope. Any Californians in here? Anybody know where the City of Hope is? Oh, we had two. We had two last time. Yeah, that's where Roz works. So we're very fortunate to have him as a user. That's in Duarte, California, right outside of LA. Yeah, but Roz is also MR certified, radiography, therapy, and CT. So he's been around and he knows how to do it all. So without further ado, I'm going to give it up to Roz here, and he's going to do the rest.
Hello. So my full name is Razvan, but you guys can call me Raz. It's easier that way, like Razmataz, Razzle Dazzle, whatever works. It's fine with me. As being a lead technic at City of Hope, started in the beginning in diagnostic in 2000, started performing MRIs and CTs in the beginning, and then attended City of Hope Therapy School and stayed there since then. About City of Hope, the way it says, located 21 miles northeast of Los Angeles in Duarte. The culture is very diverse and inclusive with strong sense of community. There's a lot of when we work together as a therapist and also taking care of the patient, we're taking care of family. So it's very helpful that way. The designated comprehensive cancer centers providing care from prevention through survivorship and innovative radiation oncology department. We're leading the way to improve patient care with the latest radiation treatments and technology, emphasizing on precise imaging and selective target treatments. The objectives today, we're going to be explaining some limitations of the common extremities treatment setup and also explaining how to achieve better reproducibility and patient comfort using the extremity board. And also describe how to adapt the immobilization device across several different uses. Setup difficulties and challenges. As a therapist, we know we always have major challenges when it comes to reproducibility of the treatment day to day and patient comfort, and also the most important duration time of the patient being on table. Upper extremities, the challenges are where patient positioning we used to use with the vac bag and the hands was immobilized with the hand base plate if we're treating shoulder, elbows, and custom cushions. And the part of the difficulty is to reproduce the same setup day to day. It's always there's complications and challenges. The lower extremities is patients positioned with large vac bags with a budding base plate accompanied by custom cushion and mask. And the adjacent non-affected leg was elevated with another vac bags, so that will be away from the path of the beam, which is that's the problem with the vac bag. Sometimes after a week later, the vac bag starts losing its integrity and losing air and becomes difficult to reproduce the leg in the same position. Also another one that the other back bag is not indexed to the table. So we don't know where it's going to be the position day to day. The type of cases and treatments that we use it's on is upper extremities such as shoulder, humerus, elbow, forearm, and hand. Lower extremities such as hip, thigh, knee, tib, fib, ankle, and foot. The modalities we use it with is the three-dimensional conformal radiation therapy, stereotactic body radiation therapy, intensity modulated radiation therapy, and image-guided radiation therapy. So improvements with the board is immobilizing the device can be indexed to the treatment table, which is very beneficial when it comes to the day-to-day. And also is a superior improvement in reproducibility making area of treatment, the way we said indexed. Patient comfort, use of custom cushions or vac bags. Setup time on treatment table, which is very short. When you have the device that is immobilized, you know where it's going to fall and becomes very reproducible with no setbacks. An accurate setup for sure. And leg support box is easily attached to the extremity board. Eliminates the need of unstable vac bag to elevate unaffected leg from path of the beam. Also, as you can see, we have a documentation form, which makes it easier from SIM to therapist information transferred. And if you're using the support leg board or not, all that stuff will be on the documentation. And it's easy to just scan it into the ARIA or Mosaic, and it stays in the patient's file. So set up treatment areas that we're going to be is the knee, where we do with the mask above and below the knee to support the knee. The thigh, where the vac bag is under the pelvis with a budding extremity board and masking of the knee and the foot for controlling the rotation. And foot, it's another one, it's custom cushion with the mask controls the rotation of the foot. And shoulders is custom cushion under the shoulder with the mask over it and mask of the elbow to better immobilize the upper arm. We also have there's also a dedicated shoulder mask with support of the arm. Hand, there's also a dedicated hand mask with custom cushion. Will immobilize the hand with no rotation and in any position that you want with no problems. Any questions? No questions. I think we did it right.
You're gonna see an upper and a lower.
Yes.
Okay.
Yeah.
We're doing a lot of osteoarthritis suddenly in our clinic, so we're interested in the extremity immobilizations.
What's the fractionation like on osteo?
I've seen 7 and 5. We've only done a handful, but I have a feeling there's more gonna be coming.
Yeah. What site specifically? Like hands or
I've done a hip, a knee, and a foot.
So no upper though.
Not yet, but I can imagine there would be.
Yeah. You have done?
Elbows, hands, hips, spine.
Whoa. And you just do 3D? Is this 3D?
Yes.
Interesting.
Yeah, you're not gonna have a problem with the extremity board. It's gonna line up perfect.
Yeah. So we'll do a group of lower extremities so everybody can get in, and then if there's time, we'll run back through and do upper. Yeah.
Is there a weight limit for the leg support arch?
There is one, but I don't know it off the top of my head yet. Good question, man. You got us with a good one.
Wait a minute
On the bridge.
I don't think so. I put someone 350 pounds down there, so I'm okay with that.
He's
I'm
testing.
giving you from my experience. Because I had a patient couldn't straight the leg, so we had to put it on the support so we can mask it on the support, so that way we can reproduce the same treatment on the leg. So
I've never heard of the osteoarthritis treatment.
yeah, me
That's
too.
great.
It's fairly new.
Yeah,
And
we
I
haven't
live in
done.
Little Indiana, but our radiation
House in the house.
oncologist has a doctor friend in California that's having great success,
Uh-huh.
and he has another one in Michigan.
For
Patients
osteoarthritis.
are noticing changes in a couple fractions.
Wow.
Really? What kind of patients are these? Like older patients or anyone?
Yeah, but they're walkie-talkie usually because
Yeah,
they're
it's
coming in to get their arthritis pain taken care of.
wow.
And does it help with mobility or just pain? Is it just a pain? Okay.
Yeah.
Interesting. I'm not thinking about that.
Never heard of this. Yes. So upper extremities, it's very beneficial because when you make the shoulder, the same position every day, according to the extremity board, will help a lot. And especially you can also abut a board with another board. If you have a person with a long arm that you try and shoulder, you can even bolt the hand to the other board and becomes part of one piece altogether. And also another way is that you can offset the board by indexing to the table, and you can know where it's indexed at because it will create also more, if you want to do a Kimbo arm or anything like that, clearance in the CT room also on the treatment side. And it's the same idea. You can abut another board with it and becomes part of the whole treatment.
And we can talk and do questions while you're up here too, if you have any specific.
Also, it's going to be showing video the
Yeah.
way we're making the devices so you guys can see at the same time.
Yeah, people who aren't waiting, you won't be bored. We have this going around so you can see how he used to do his setups and then how he does it now.
Yes.
And then we're going to have Roz walking around in case anybody needs to ask him questions about what's going on in the video. Yeah, so we'll do these 4 over here. And then we'll have you making some foot masks over there. And then these 5, we'll have you come over here. Okay.